Hello, I'm Dr. Jacqueline Small, President of the Royal Australasian College of Physicians. I would like to acknowledge the Gadigal people of the Eora Nation as the traditional owners and custodians of the lands I'm speaking on today. I extend my respect to all Aboriginal, Torres Strait Islander and Maori people. Together, we restate our shared commitment to advancing Aboriginal, Torres Strait Islander and Maori health and education as core business of the RACP. Today, I'd like to talk to you about quality and safety in healthcare. At first glance, these two concepts might seem like a given. Surely, for all the pressures and issues our health sectors face, they are fundamentally high priorities. Australia and Aotearoa New Zealand healthcare systems generally sit in the middle of the OECD international rankings of quality and safety. In a 2022 Foundation for Research on Equal Opportunity Index of 31 nations ranking countries regarding their healthcare and medical innovation, Australia came 11th overall, but second behind Switzerland for quality of healthcare. Aotearoa New Zealand ranked 20th overall and 6th for quality of healthcare. But I particularly want to highlight two areas: clinical standards and their relationship to patient-centred care. We all know the quality of healthcare can be variable across our two nations. One way of highlighting and then changing this is through the use of clinical standards. As you may know, these standards set the quality of care a patient should receive for a clinical condition or pathway in line with current best evidence. They're both an aspirational target and a litmus test of care in any setting. Professor Anne Duggan is the CEO of the Australian Commission on Safety and Quality in Healthcare. She says, "Patient safety and quality is often summarised as the right care in the right place at the right time and cost. Australia is a high-performing health system, but we know we can do better. We know from hospital-acquired complication, HAC data, that care is not always safe, and from Atlas data that there is unwarranted variation in the quality of care we provide. I have personally been involved with setting Australian national standards for the rights of people with intellectual disability to equitable healthcare. People with intellectual disability experience significant barriers in accessing safe and quality healthcare. They have higher mortality rates, increased incidence of preventable illness, and more frequent hospital admissions. Working with the Australian Commission on Safety and Quality in Healthcare, we now have 4 defined steps that set the standard of care that should be met or aspired to for people with intellectual disability. These steps are: plan with me, understand me, communicate with me, and act with me. Meeting those standards is the target, and anything less needs improvement. Why are these standards important? First, they ensure care is patient-centred. Treating a patient with dignity and respect, involving them in all their decisions about their health care, results in best healthcare outcomes. Clinical governance and national standards are key pillars in the safe delivery of healthcare. As Professor Duggan points out, good communication between clinicians and patients, their families and carers is also crucial to foster improvements in care. This is especially important during transitions of care, when people move between healthcare providers. The Commission has developed a practical user guide for the review of clinical variation in healthcare. Using this guide, clinicians can individually, or as part of their clinical review group, examine key clinical outcomes and activities. This allows reflection and may help clinicians identify opportunities to improve their evidence-based practice. As a gastroenterologist, says Professor Duggan, I'm aware of many colleagues who have reviewed their department's surveillance colonoscopies against best practice and made substantial improvements in equity of access based on the colonoscopy clinical care standard. But health standards have a much broader purpose. They can also point to things we should stop doing that provide little benefits to patients and waste time and resources. estimations of waste in delivering unwanted care are startling. In Australia alone, it's estimated that nearly a third of the healthcare services delivered to patients makes little or no difference to their ongoing health. Healthcare standards guide us in reducing the burden on our health services and health professionals from activity that is simply not needed. Think of what could be possible if we diverted time and resources away from these. What can you, as physicians, do? Healthcare standards are directly relevant for your continuing professional development. If you're a clinician, get involved in the activities of the Australian Commission on Safety and Quality in Healthcare, or Te Tahu Hauora, the Health, Quality and Safety Commission in Aotearoa, New Zealand. And if you're a clinical leader, ensure good standards of clinical governance within your clinical teams. On a completely different topic, our focus as a college is primarily Australasian. It's easy to forget that we have just over 1,000 members internationally in over 10 different countries and territories worldwide. In the United States recently, where we have 203 fellows, I was at the American College of Physicians meeting in San Diego and met one exceptional RACP fellow. Professor Virginia Hood, FRACP, originally completed her fellowship training in nephrology at Royal Prince Alfred Hospital and her third year of fellowship training at the former Medical Center Hospital of Vermont. Resident in the US since then, she became a member of the American College of Physicians in 1991 and gained a master's degree in public health from the Harvard School of Public Health 2 years later. She's held many distinguished offices in the ACP, but in 2011 she reached the pinnacle. Virginia was elected for a 2-year term as president of the American College of Physicians, leading 160,000 internal medicine physicians, subspecialists, residents, fellows, and medical students worldwide. I found meeting her inspirational, and she stands as an example of how our fellows continue to contribute to the practice of medicine on the global stage. Thank you for watching.